The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome again to the Leading Age Michigan Safe and Calm webinar for February 3rd. This is Deanna Mitchell, and we have continued to monitor COVID caseload, both in the state and in long-term care facilities, and trends are looking very good, especially in comparison to other states. So we are hopeful, and with vaccinations, we are especially hopeful. But we also know that the pandemic is far from over. This morning, we're going to be using our routine agenda, starting with an advocacy update from our Director for Public Policy, Dalton Herbal. We'll follow with a brief summary of the Michigan data, and we'll end with updates. There are no major changes in any of the regulations or guidance recently, but there have been quite a few tweaks and some new messages. So we do have some important information for you this morning. We'll now turn the presentation over to Dalton.
Good morning, everyone. I want to update you on kind of what's been going on and what we've been doing over the last week or so. Just so you know, generally in Lansing right now, the legislature is still organizing. They had some delays due to some security concerns that you probably saw on the news. So the first week they were a little delayed. And then last week, the committee structures started to meet, and they had their organizational meetings, which are required by law. And this week, we are seeing our first kind of committee hearings, but since there's not a lot of bills to go through the process right now, they're mostly focusing on some kind of resolutions and other things of that nature. Within the last week, though, I did want to highlight that we did set a letter to the governor and to Director Hertel last Thursday. There's a photo of it there. If you want a full copy, it's 2 pages. Please feel free to reach out to me. The letter itself focuses on visitation restrictions as we look to take a firmer stance on the rights of seniors in our settings to have visitation. The letter itself focuses on vaccine efforts, the well-being of seniors, and urges the governor and Director Hertel to follow recommendations that came out of her own visitation work group back, I want to say last spring or last summer. In a response from Director Hertel, she noted that they're excited to work together as she starts to get her kind of on firmer ground in her new position and role. So we'll see where these conversations go going forward, but do know this is something we're going to be acting on in the go forward, especially via our Give Seniors a Say campaign, which should be formally rolling out soon. The governor also gave her State of the State address. I want to say it was last Wednesday, so probably a week ago. During that, she gave a sneak peek of what her budget proposal is going to look like. I think I put some of the slide data here kind of out of order. Typically, in late February, early March, we expect to see the governor have a budget proposal that she sends to the legislature, which they then start to negotiate the budget for the ongoing year. This year's budget has a sunnier outlook than anticipated because the COVID kind of economic indicators weren't as bad as people thought, and spending was also up thanks to federal stimulus, online shopping, home improvement, etc. We've covered that on previous webinars. During her speech, though, she did talk about her desire to make the $2 an hour direct care worker wage pass-through a permanent program. There hasn't been a ton of conversation about that right now, as a lot of the air is being sucked up by the call for winter sports for students to be played. So these conversations haven't started yet, but they will soon. Then she also wanted to expand/extend the Future for Frontliners program, which is the program where she offers, or the state would offer, funds for frontline workers to go to school to either get a license or further their education licensure. I did also want to note that Lansing is gearing up for an election year. You may have seen that Governor Whitmer has released public information that she has a record-setting level of funds in her campaign account going into the next election season, which will be 2022. This looks to be a big election season, as we'll have the House, some senators, and the governor all up for re-election. It's going to be a very political year in Lansing, so expect it to be kind of dicey, as right now the relationship between the legislature and the governor isn't great. And by dicey, I don't mean in terms of like instability. I mean in terms of them kind of taking shots at each other publicly. If political discourse kind of dies down, I think that'll be a good thing for everyone. Lastly, I wanted to touch on our public policy task force. I had reached out to some of the people who volunteered their time early on, and it looks like we're going to have our first meeting February 22nd. That's not a hard date right now, but if you are interested, we are in the process of putting together this task force. I put the charge for the task force here because I realized I had talked about the task force, but didn't formally tell you what it was all about, which would probably help those who might be interested. I'm not going to read it word for word because it's kind of long, but do know that it's really about developing policy which help not-for-profit organizations. It's about studying and interpreting public policy issues, and then formulating and preparing testimony for the legislature. It should be kind of fun for those of us who like policy, and I think the members of the task force right now are really a fun group and exciting to be with. So if you're interested in getting more involved or joining the group just because you like policy discussion, please feel free to do so. There's still some slots open. You can contact me at my email there. Moving on to our more traditional important date slide. I did leave a past one there just as a reminder that the deadline to submit expenditure documentation for nursing facility infection prevention grants to MDHHS was 2 days ago. Also, you should be seeing the PRF payments in your account now. From my understanding, those were being released last week. So if you are still looking for those, let us know and we can see what we can do. We did hear that there may have been some delays for some providers, but most of them should have been going out. As always, talking about the direct care wage for pass-through thing, the end date is the 28th. The governor's looking to make that a more permanent program. We'll see where that goes in budget discussions. 2 new items here. Leading Age National is asking for comments on the national standard for HUD's physical inspection program. For those who don't know, the physical inspections of HUD buildings have had a kind of regulatory change suggested at the national level. And those of you who are interested can read more about it by clicking there. And then if you do want to submit comments, submit them to that email there. And then lastly, the eviction moratorium was also extended till March 31st. And so that date is on here as well as we look to track that in the future.
All right, thank you very much, Dalton. It actually does not look like we have any questions right now, so we can go ahead and move forward, Deanna.
Okay, great. Thank you, Blake. Excuse me. So we will turn to our situation update. This next slide is a CDC map as of yesterday, and it demonstrates the caseload per 100,000 persons for each state. And this obviously shows you that Michigan sits among a handful of states with case rates below 19, between about 19 and 36. So you can see comparatively, there are a lot of states that have high rates of transmission and many difficulties, and Michigan is doing quite well comparatively. This slide, also from the CDC, identifies the states with emerging variants. And Michigan has had several cases. This data was updated just this morning. And Michigan now reports 22 cases of the B.1.1.7 variant. This is a variant discovered by the UK. It is possibly associated with an increased risk of death, but that has not yet been confirmed, and they're studying it. There are no cases of the South African variant or the Brazil P1 variant in Michigan. All of these variants seem to spread more easily, but so far at least it appears that the current vaccines will recognize and protect against these variants, but it's not clear if they will protect quite as effectively. So ongoing studies are happening as we speak. Looking at the caseload here in Michigan, this is again the 7-day rolling average of new cases. As of 2/1, you can see that there continues to be a downward trend. Additionally, the number of hospitalizations for COVID appears to be decreasing as well. And currently we are down to about 1,400 persons hospitalized across the state. And as we have noted before, we currently do have one of the lowest caseload rates in the country. The 7-day rolling average for deaths also continues to decline, although it tends to spike up and down a bit. And a lot of that might be due to batching, but also the fact that deaths follow the caseload trends. But you can see the last few weeks, they do continue to decline. This is a new thing, I think, from the CDC. I've not seen this graph before. It's a slide that looks at the forecasted trends for each state, and this is, of course, Michigan, over the next month or so. And you can see trending downward, although it does seem to be leveling off a bit. But it looks like the forecast is good for Michigan, at least in the near future. This is the same kind of projection for deaths. And for the next month, they do continue to decline as well, but more sharply. And that might, again, be due to that lag period. So since last week, there's been a marked improvement in the CMS county positivity rates across Michigan. This data that's presented here, the most recent graphic on the far right, is collected through January 27th. So there's still a bit of a lag time here. And the case positivity rates we anticipate would have improved much since January 27th. You can see that the number of counties in the red category remained stable, but fairly low at a number of 8 from last week to this week. But there's been a significant shift from yellow to green categories otherwise. Most counties are still yellow, meaning they have a positivity rate of between 5 and 10%. And MDHHS reported the 7-day average to be 4.9 across the state as of Tuesday. But even with those improvements, yesterday afternoon when we checked the data, the number of counties at level E was still 68 out of 83. It appears that visitation can start in the other 15 counties now, and hopefully more soon, but there seems to be a significant lag between the state rankings and the county positivity rates. With those decreases in caseload overall, we also continue to see a slight decline in the number of nursing home cases. Although it has plateaued a bit, it is doing better. And this is as of Monday. Monday's data as reported for the week prior. Excuse me. And after a huge spike just 2 weeks ago in homes for the aged cases, it is also declining. And we can see declines in the Michigan AFC rates as well. So across all 3 of those settings, we continue to see declining caseload. So that brings us to a total of almost 43,000 cases in long-term care facilities, and that would include both residents and staff, and about 5,500 deaths. This data, except for the cumulative data, obviously, is for the past 7 days as of this last Monday. One of the things that seemed a bit striking was to see 8 employee deaths in AFCs over the past week. That's a high number of deaths in any setting, long-term care setting that we've seen across the last week. So that's something perhaps to watch. So let's move on to updates and guidance. This morning we're going to start with a brief vaccine update. Michigan, the governor's administration and MDHHS put out some data this week. Their current goal is to vaccinate 70% of adults, and they also have goals to ensure that the vaccines are administered in a timely fashion after they've been distributed. As of early this week, over 1.7 million doses had been distributed, and about 57% have been administered to date. Over 111,000 doses have been given through the Long-Term Care Pharmacy Partnership Program. So as you can see on the slide, Michigan has a dashboard that displays the vaccine administration rates, and the link is there. And there's also a link to the department's updated goals and principles here at the bottom of the slide. There continues to be a huge number of vaccine-related resources and information. So we want to remind members of those that seem to be most pertinent. The CDC FAQs on vaccines was updated this week, and so we have linked it there on the slide. And also, recently, the Institute for Healthcare Improvement has published some resources intended to assist with conversations with staff who might be hesitant to receive the vaccine. Those links are here, and one of the resources seems rather innovative because it helps providers be prepared for questions and comments from staff in advance. So there's been a lot of discussion about whether or not you can mandate the vaccine. The federal government cannot mandate a vaccine that is approved only under emergency use authorization. But the regulations are completely silent about employer, local, or state mandates. Legal experts have told us that it is allowable for providers to mandate, but there are a large number of issues that could possibly accompany that. Additionally, for providers who do choose to mandate vaccines, there are exceptions that must be allowed through the Equal Employment Opportunity Commission, and that the link to their December statements and requirements about that is noted here. Another thing to note is that employers could be subject to workers' comp claims related to any adverse reactions or other injuries related to the vaccines themselves. But that's not really a surprise. Before we move on to the next piece, one of the things that I want to, no, I'm sorry, let's move on. We're in the right place. Non-work related vaccines. There is also some recourse for claims based on reactions or injury from COVID vaccines for people who did not necessarily receive their vaccine through a work program. And this program is called the Countermeasures Injury Compensation Program. And this was designed specifically for COVID-19. It is different than the program that covers issues related to childhood and influenza vaccines. So it's just an option that you might want to know about. Many providers are offering incentives to accept the vaccine. And one of the things that we're getting reminders about is exposures. If a community person has an exposure there is a need to delay the administration of that vaccine. However, if staff have a known exposure, you're not supposed to delay that vaccination. Recognizing side effects. There is new guidance from the CDC about how to evaluate potential vaccine side effects. People are reminded that symptoms of fever, fatigue, headache, chills can occur as a side effect of the vaccine, especially if the person is younger and or if this is the second dose. These symptoms should be very mild. They should occur within 1 to 3 days post-vaccination. If they do not resolve after about 2 days, they really should be investigated. But respiratory symptoms are not a side effect from the vaccine and so must be considered indications of a possible COVID infection and evaluated as such. And this is really not new, but the CDC did update its guidance about this a little bit more specifically. They also warn that people should be alert for immediate allergic reactions. And I think the details in this new guidance is really in the grid that they include, because for each kind of set of symptoms, there's a grid with suggested approaches. And another reminder is that Leading Age on its website always has a vaccine FAQ that they also update very frequently. So some of the issues that have come up with vaccines. We have noticed that there have been a lot of questions, and there have been questions to CMS about some of the residents and their requests to be cared for by vaccinated staff only. Can they room with vaccinated roommates only? Can a facility deny admission based on vaccination status? Or can they cohort based on vaccination status? One of the important things to remember is that an individual's vaccination status is protected health information. So no one has the right to know beyond their immediate medical caregivers which residents or staff have been vaccinated. Likewise, it's possible that some staff would not necessarily have the right to know whether or not a resident has been vaccinated. So the question about requests to be cared for by vaccinated staff only. CMS suggests that these requests should be handled like any other staffing request. Residents have the right to request specific staff, and nursing homes should consider that and accommodate requests as able, but they are not required to accommodate requests. CMS expects that all staff will provide safe care regardless of the vaccination status of either the resident or the staff. In terms of requests for roommates with vaccinated, who've been vaccinated only, again, these requests should be handled like any other room change request. Residents have the right to request a room change. Nursing homes should consider and accommodate those requests as able, but they're not required to accommodate requests. Cohorting. It might be a good idea to cohort according to vaccination status. However, there's no requirement to do so, but there's also no requirement that prohibits it. So CMS is not coming out with any specific guidance about that. You just have to be careful that you are not discriminating against resident rights as you do that, if you choose to do that. One of the last question here, can a facility, oh, this is the third question. Can a facility deny admission based on vaccination status? Admission cannot be denied solely on the basis of that status, or if they are hesitant to receive vaccination in the future. So that would not be a legitimate reason to deny admission. So we're going to pause for a few questions.
All right, thank you, Deanna. Right now it actually, okay, there we go. We just had another one pop in. Is the state still behind in reimbursing facilities for the $2 an hour for direct care workers?
My understanding is that Dalton just spoke about that a little bit, and I think that they're about to catch up. Dalton, do you have an update about that?
Yeah, they're working to catch up with it. They said that they estimate mid-February, so hopefully in the next week or so. They're behind on the November, December payments, I believe. I didn't follow up with them to note, and I haven't heard anything about January delays. If you did receive a January delay or you haven't received a January payment, but you've received November and December, please contact me. Just so I can kind of stay in the loop of where this is all going from both sides. That'd be great. Thanks.
Okay. Someone just said we just received our late payments, just so you know as well.
Good.
We just had an infection control collaboration survey, and the surveyor told us that Michigan regs recommend facilities to have staff vaccine information for all vaccine. This seems to be opposite of what you are saying, with vaccination status being protected health information. What are we supposed to do regards to that?
Can you repeat the part about what the surveyors or whoever that was said again?
So we just had an infection control collaboration survey, and the surveyor told us that Michigan regulators recommend facilities to have staff vaccine information for all vaccines.
Okay, I'm not sure what that means. If you're saying you do have to provide information
they just
to the
typed
staff about,
and said they said that we need to have a record of what vaccines our staff have had.
yes, you do need to have a record of what vaccines your staff has had, but staff who are working for you do not have the right to know which other staff may or may not have been vaccinated. That's the piece. So that's protected health information. It's just like an influenza vaccination in that respect. You have the right and the need to document who has been vaccinated if you provided that, but other staff who are not involved in that do not have the right to know who's been vaccinated.
All right, she said, got it, thank you. What is the plan to vaccinate residents after contract with Walgreens or CVS is done?
We're going to talk about that in just a few minutes, so I'm going to delay that question.
Okay. What is the expectation of new hires in SNFs that have missed the vaccination clinics, or if the new hires are coming in on the last vaccine clinic?
That's the same question really as before, and we're going to talk about that in a minute.
All right, well, that was the last question, so we can go ahead and move on to that.
Okay, we're going to start this next section with a few brief housing updates. Round 2 payments should have been started to be distributed this week to housing providers. Leading Age continues to suggest that housing members track their costs because they do believe that there could very well be a round 3 of provider relief funds. So please make note of that. Dalton did refer to the eviction moratorium being extended to March 31st. The link to the actual verbiage is available on that page. And that is actually through the Leading Age discussion of it. So there's a Leading Age informational piece about that. There are several requirements that must be attested to. We're going to cover those in a slide that's coming up. So additionally, in December, the Emergency Recovery Act was passed by Congress, and that act provided support for rent relief to persons who lost income or had financial distress related to COVID. And although the qualifications to be covered by this program are really pretty general, Leading Age has some concerns about it, and they have sent letters to federal agencies supporting the need to ensure that seniors have access to help with their rent as well. It's unlikely they've lost income related to COVID, but they could be suffering in other ways. So it's really unclear at this point how seniors might be covered under the program, but Leading Age wanted to ensure that they were definitely included. We're going to review those requirements shortly as well. And the links on this page are to the Leading Age summary and to the Leading Age letter that was sent to Congress. And last but not least, under housing, HUD is presenting a webinar on COVID-related scams in housing. And this webinar is scheduled for this afternoon at 2 p.m. And the link to register if you desire is here. So the rationale behind the eviction moratorium is that evictions substantially contribute to COVID transmission, especially if there's a risk for homelessness. And again, it's been extended to March 31st. And the qualifications in this extension they have been updated to be much more broad, and they include any covered person, and we'll talk about who the covered persons are in a moment, in any state where there are documented COVID cases. And right now there is no state without documented COVID cases. The moratorium, remember, does not alleviate a person's responsibility to ultimately pay their rent, and providers can still evict for certain issues such as criminal activities, safety issues, damage to property code violations, etc. And the link to the actual language in the rule is right there. So in order to qualify, a covered person must provide a written declaration that they meet these general qualifications. They must have tried to obtain government assistance for their rent. Their income can't exceed $99,000 for a single person. There's a couple limit as well. Or if they did not report any income for 2020 or did not have to. If they did receive a stimulus check under the CARES Act, they will qualify. They must be unable to pay their full rent payment. They can make a partial payment, but they must be unable to pay their full rent payment due to income of loss of income, wages, layoff, medical expenses, etc. They need to have made a best effort to at least make a partial payment. And this is the important piece. The eviction would likely render the person homeless or force them into another shared housing area. So that's the piece that HHS cares about and CDC cares about, because that movement is a risk for greater transmission. The Emergency Relief Act was approved by Congress in late December, and we just talked about that. It helps with rent for persons with reduced income or high costs related to COVID. And these persons, too, would have to have a risk of becoming homeless. Leading Age believes that few seniors will be able to benefit for this program, and this is the piece that they're working for. It defines eligible households, but it really is focused on income and loss of income. But Leading Age's issue is that seniors without income loss are also facing certain hardships. The current rules for this and all the links to the Emergency Relief Program are listed here on the slide. The Provider Relief Fund FAQs have recently been updated as of late last week. Currently, it's something like 60 pages long now. And the link to those updates is on the slide. Both HHS and Leading Age is recommending that providers who have had more than $10,000 in total payment should go ahead and register in the provider portal now if you've not done so. Apparently it takes about 20 minutes, but it starts that process. The links about how to do that and the portal are here on the slide. And we're still waiting for final guidance about entering data and the final due date for submission for 2020 data. But Leading Age suggests that you kind of get ahead of this and go ahead and register. A few notes from the CDC, and this is where we're going to start talking about the Pharmacy Partnership Program. There has been a lot of media coverage and concern about the fact that some of the vaccine doses have been diverted from the Pharmacy Partnership Program. But the CDC wants to ensure that people understand that the doses diverted were done so because the allocations were more generous to nursing homes than needed. And a lot of that is because of the low staff rate for vaccination. Additionally, the CDC does not anticipate changing any of their mask guidance based on the presence of these new variants. They believe that the important element about the mask is not the thickness of the mask, but how it fits the face. So it's important about how it covers the entire face, nose, and mouth closely. They think that is the most important piece rather than thickness again. They believe that 2 masks may make that fit harder rather than easier. So they are not suggesting any changes to their mask guidance. So additionally, first of all, I made this slide yesterday afternoon and it has changed since I made the slide. The CDC is currently working on the next program for pharmacy clinics, and this is the opportunity to continue to vaccinate new admissions, new staff, people who had not been vaccinated before. There is absolutely no plan for SNFs to be administering any vaccines by themselves until there are vaccines that do not require ultra cold storage. This retail pharmacy program was actually announced late yesterday. HHS has issued that plan and anticipates starting this initiative as of February 11th. Now, how extensive that initial distribution of vaccines to these pharmacies is hard to say because vaccines will be distributed to them as they are available. So as of February 11th, some local retail pharmacies will be able to start vaccinating. I would go ahead and contact your local health department in mid-February for, and of course, unless you still have clinics scheduled with your pharmacy partnership group. The other thing about the retail pharmacy program is that they are taking an approach that is intended to make distribution more equitable. I'm sure that you've all seen a lot of data saying that racial and ethnic disparities have been, of course, prevalent in many areas, but also in vaccine distribution. So it's possible that some of the pharmacies may get more vaccines in the beginning in areas where there's a lot of diversity. But as soon as we have a chance to review this guidance, and I think the general information about it came out last night, we will certainly let members know. But this is the planned way for everyone to continue to vaccinate their residents and staff on an ongoing basis. The CDC has also updated its guidance for point-of-care testing. For anyone suspected of having COVID, obviously full PPE must be used if you're doing point-of-care testing. There is a link here to the updated interim guidance for specimen collection. And also, the CDC proposes that point-of-care providers conduct a risk assessment in advance of specimen collection to identify potential hazards. And that's a piece that I had not seen before. So they're suggesting having a mock procedure to ensure that the collector is safe, not exposed to the persons being tested, that the collector doesn't touch contaminated objects during the process. And there are links here to the best practices for risk assessment and also the guide to safe handling of samples. So this updated guidance about specimen collection also includes reminders. And these are important because the CDC believes that a lot of the false positives may be due to user error. So it's important to remember to review these bullets, but focus on the importance of changing gloves, making sure the test kits are not expired, making sure that the supplies are stored and sealed properly before use. And one of the major considerations is the timing of the entire test process, making sure that you are waiting the specific length of time needed, because that's a little challenging when you're doing a large number of tests daily. But that's a huge focus of the CDC right now because they believe a lot of the false positives is due to user error. Yesterday, the department issued some new guidance regarding COVID testing. According to this, they are allowing any appropriately trained person to conduct COVID point-of-care tests, process the test, or submit tests to laboratories. And to be honest with you, when I read this, I thought that we already had that ability. But they put out a specific guidance that said that yesterday afternoon. The person conducting the test must first evaluate the person for symptoms, provide information to that person, offer an opportunity for questions to be answered. They have to ensure that there's been consent. They have to ensure that the test has been administered properly, and then, of course, document. And lastly, they also must notify the individual of all test results and report as needed. They have to identify any positives and notify the local health department of those as well. And the link to that new guidance is here. Doesn't seem to change practice on our end much, but it is a new guidance that came out yesterday. Along with that, the department also issued a rule yesterday that physicians may issue standing orders for CLIA waived tests that have emergency use authorization. This is allowing tests to be completed where there are no medical staff in order to increase access to testing. And to be honest with you, I didn't think this changed much either. But again, they put out specific guidance yesterday about it. This morning we have a few nursing home surveyor reminders and updates. We want to make sure that everyone is aware that Larry Horvath from the Bureau of Community and Health Systems, he has asked surveyors and licensing consultants to approach providers that they know in order to assist them in obtaining the vaccine. So if you are approached by a surveyor, do not be alarmed by that. They have been told to contact providers in the hopes of obtaining some vaccines. They feel that this will only improve the safety precautions for facilities since these surveyors are moving in and out of them on an ongoing basis. And apparently there have been some problems with surveyor staff who have had no other documentation about their test results. As we all know, they need to be tested before entering your facilities. And apparently they have presented with sometimes nothing other than a phone message. The department, the Bureau, did develop 2 letters that attest to their testing status. There's a template confirmation letter and an exemption letter. And the surveyors are supposed to use those letters. And the department said that they will remind their surveyors to that effect, that these are the mechanism for reporting to facilities. And if you want to review what the templates look like, the links are here on the page. So, and lastly, there continues to be some issues in getting certification tests completed for nurse aides. Apparently, there's a limited number of test sites and there's a limited number of proctors available through Prometric right now. I think sometimes the limited test sites have to do with the limitation on proctors. The department has been working to solve this problem. Facilities have been encouraged to become a testing site in order to assist. It is also possible for facility staff to act as a proctor, but in order to do so, you have to be at least a part-time employee of Prometric, and you can't proctor tests at your own facility. They do note that there's no training certificate required for proctors, and anybody interested in doing this can contact Prometric. So that pretty much are all the updates that we have today. Do we have any questions?
All right. Thank you, Deanna. We do have a couple questions here. MDHHS, do they want both negative and positive test results in the MDSS or just positive?
Okay, my understanding is that your normal reporting automatically floats to MDSS. That was an issue when that updated guidance came out several weeks ago that was so confusing. So I'm not sure what the requirements for MDSS are, but your normal reporting mechanisms automatically float there. So whatever those requirements are for EM resource or I forget the name of the links for AFCs and HFAs, would suffice.
Okay. I thought the latest FAQ for HFA AFC indicated licensing consultants do not need testing to enter. Am I correct?
That is correct. It's only nursing home surveyors that are required to be tested.
Okay. So to clarify, the order for CLIA waiver facilities to enter all POC testing into MDSS within 4 hours still remains applicable to SNFs.
We have never gotten 100% clarity about that order. And even though we have tried several times, we did receive partial clarity. The 4-hour piece is what they continue to not respond to. But we heard from the department that long-term care facilities, through their normal reporting, which would apply to SNFs, HFAs, AFCs who are required to report, all of the information that's necessary for MDSS flows through their normal reporting mechanism.
Okay. Well, as of right now, that actually looks like it was the last question. So if you do think of anything after this webinar has concluded, as always, you can email either the Safe and Calm, Dalton, or Deanna at leadingagemi.org, and we will make sure to get any questions answered for you. Again, just another reminder, we are no longer doing Safe and Calm webinars on Fridays. So our next webinar will be, I believe, February 10th. So next Wednesday at 10 a.m. Eastern Standard Time, as always. So at this point, we would like to thank Deanna and Dalton, and we would also like to thank the 95 members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. With that, I hope everyone has a great remainder of their Wednesday, and we will see you guys all next week. Thank you and have a great day.
Take care, everyone.
Bye, everyone.